Well, my friends, this is a case of a gentle lady, age about 65 years, has been suffering from esophageal CA. That means the growth in the esophagus. Esophageal growth diagnosed by biopsy, moderately differentiated squamous cell carcinoma. So the case is very pathetic, and many persons in the advanced age suffer from esophageal carcinoma. Now, esophageal carcinoma, if you look the picture, mouth cavity, esophagus, I have already mentioned in different videos that the lower third of the esophagus, lower part of the esophagus, when the sphincter muscles are not act properly, as a result of that, food cannot go down into the stomach. The condition is known as achalasia cardia. But the growth, carcinoma's growth generally appears near the lower esophageal sphincter or at the upper part of the esophageal sphincter. If the growth or CA develops at the upper part of the esophagus, it is known as squamous cell carcinoma. It is known as squamous cell carcinoma. But if the growth near the lower part, at the lower end, near the cardiac orifice, the carcinoma may develop, and it is known as adenocarcinoma. So, carcinoma at the upper part is known as squamous cell carcinoma, and carcinoma of the lower part of the esophagus is known as adenocarcinoma. This gentle lady has been suffering from the biopsy report, moderately differentiated squamous cell carcinoma. That means the growth at the upper part of the esophagus. Esophageal growth, the carcinoma, is a very pathetic case. The patient didn't fail any other complaints except he or she cannot deglute any foods. Difficult to do deglutation. খিদে আছে, খাবার খেতে চাই, অন্য অসুবিধা নেই, চোখের সামনে খাবারটা আত্মীয় পরিজনরা আনছে, কিন্তু রোগী ঠিক মতন খেতে পাচ্ছে না। প্রথমে সলিড ফুডগুলো আটকায়, লাস্টের দিকে জলটাও আটকে যায়। সো this is a very severe condition, cases in medical science. The high prevalence is gastroesophageal reflux. ওই যে গ্যাস্ট্রোইসোফেজিয়াল রিফ্লাক্স হয়ে থাকে, উপরের দিক থেকে হজম হয় না, অ্যাসিড ওটার চাপ দিয়ে থাকে, সেই অ্যাসিডগুলো জমে জমে লেগে লেগে এরকম হওয়ার ব্যাপারটা থাকে। সো পেশেন্টস হু আর দ্য ভিকটিম অফ গ্যাস্ট্রোইসোফেজিয়াল রিফ্লেক্স ডিসঅর্ডার GORD, তাদের ক্ষেত্রে বেশি সম্ভাবনা থাকে, এবং যারা প্রচুর পরিমাণে অ্যান্টাসিড খেয়ে থাকে, গ্যাসের বড়ি খেয়ে থাকে, তাদের ওই পাকস্থলিতে হজম করার অ্যাসিডটা আর কাজে লাগে না, বাইরের থেকে গ্যাসের বড়িগুলো হজম করে দিচ্ছে, এক্সট্রা অ্যাসিড উপরের দিকে চাপ দেয়, এবং তাদের এই রোগ হওয়ার সম্ভাবনা বেশি থাকে। So despite the modern treatment, the overall survival rate is very low. It is very pathetic condition. Despite all the modern treatment, the overall survival rate in many patients maximum 5 years. But many patients will die within this period. Now the main symptoms are a history of progressive painless dysphagia, a history of progressive painless dysphagia for solid foods. সলিড ফুড গিলতে অসুবিধা হতে থাকে। ফুড বোলাস অবস্ট্রাক্টস ইন দ্য esophagus. Food bolus obstructs in the late stages, and there is of course for the carcinoma common symptom weight loss, anorexia, anemia, chest pain or hoarseness may develop due to pressure of the recurrent laryngeal nerve when the disease spreads and captures the mediastinum. So this is the condition. Now for homeopathic treatment, the patient has come to me along with the chemotherapy treatment. Now I have found whether any carcinoma medicine, though we treat the patient, not the disease, we may consult repertories, but in Murphy's repertory, there is no rubric given for esophagus even. No rubrics given even for esophagus. See the Robin Murphy's contents. There is no rubric for esophagus or gullet. Another name is gullet or gullet. No rubric is given in the Murphy's repertory. So I opened the Kent's repertory. In the Kent's repertory, all the esophagus symptoms are given in throat. So I opened the throat chapter. You will open the throat and you will see whether there is carcinoma rubric or not. Carcinoma in throat in general or esophagus, there is no carcinoma rubric. Yes, there is carcinoma rubric. Carboanimal is ledum and tarantula. No specifically organ is given as esophagus. So carcinoma growth in the throat, some medicines are given. Now it is a lump. It is no doubt a lump or a tumor, a growth. So may I search the lump in the throat? Lump or plug, etc. sensation of. So in Kent's repertory, the philosophy is from general to particular. General to particular. So in general he has given many medicines, and after that he is giving some particular parts. Here is given esophagus. So lump in the esophagus, there are some medicines, causticum, china, plumbum, pulsatilla, etc. So what is the function of repertory? A repertory only helps us to find out a group of drugs. See, lump in the esophagus, there are a group of drugs. But to finalize one medicine, to scrutiny one particular medicine, the final choice depends on knowledge of mathematics and knowledge of your common sense. So among these medicines I have seen causticum is given in the lump of esophagus. Now this is a carcinoma, so this is nothing but a growth. Every time I am telling that the common sense you should apply, and repertory, mathematica, etc. will be used by your common sense. This is a carcinoma. From the knowledge of practice of medicine, I have understood, I know that carcinoma is nothing but a tumor, a growth. Growth may be benign, growth may be malignant. So it is nothing but a growth. So that's why I have seen in the lump, and there are many medicines, and among the medicines, causticum represents the maximum similarity in this case, because these are for salt, aversion to sweets, and sympathetic mind. So and anxiety is there. So I prescribe causticum in 50 millisimal scale of potencies, and here the repetition is frequent, repetition given frequently, because to consider the severity of the disease, the progress of the disease, and 50 millisimal, as the 50 millisimal scale of potency, as the 50 millisimal scale of potency, there is less chance of aggravation, and it can be repeatedly used. So that's why I have given this medicine with the direction thrice in a day. So let's prescribe causticum in 50 millisimal of potency with the direction thrice in a day, morning, noon and evening, and let's see the result for the malignant growth of the esophagus of this poor lady. How much improved we may expect from causticum, and that means by homeopathy. Let's see the result. I shall share you, my friends.